Welcome, future nurses. In today's session, we're diving into 50 high-yield Nclex case study questions designed to challenge your critical thinking skills and elevate your clinical judgment. These are not just regular questions. Each case mirrors real patient situations you'll encounter in practice. Whether you're preparing for the next-gen Nclex or reinforcing your decision-making skills, this collection will sharpen your ability to analyze symptoms, prioritize nursing actions, and select the safest interventions every time. Stay focused and take your time with each scenario. Mastering case studies is one of the strongest predictors of Nclex success. Let's get started.
Question 1. Case study scenario. A 46-year-old patient with ARDS is on mechanical ventilation. The nurse notes a sudden drop in oxygen saturation from 95% to 82%, decreased breath sounds on the right, and tracheal deviation to the left. Question: which action should the nurse take first? A. Increase FiO2 on the ventilator. B. Reassess the ventilator settings. C. Disconnect the ventilator and manually ventilate with 100% oxygen. D. Notify the healthcare provider immediately. Answer: C. Disconnect the ventilator and manually ventilate with 100% oxygen. Rationale: findings indicate tension pneumothorax. Immediate manual ventilation prevents further barrel trauma. Strategy: sudden ventilator deterioration equals secure airway and ventilation first. Question 2. Case study scenario. A 72-year-old patient admitted for pneumonia suddenly becomes confused, tachycardic, and hypotensive. BP 84/52. Urine output is 15 milliliters per hour. Question: what should the nurse do first? A. Administer prescribed IV antibiotics. B. Obtain blood cultures. C. Begin IV fluid bolus. Or D. Apply warming blankets. Answer is C. Begin IV fluid bolus. Rationale: patient shows septic shock signs. Fluids restore perfusion. Strategy: in shock, fluids, then antibiotics first. Question 3. Case study scenario. A 38-year-old with type 1 diabetes presents with nausea, fruity breath, and rapid deep breathing. BG equals 510 milligrams per deciliter. Potassium equals 5.8 milliequivalents per liter. Question: priority action. A. Administer subcutaneous insulin. B. Begin IV regular insulin. C. Administer sodium bicarbonate. Or D. Restrict fluids. Answer: B. Begin IV regular insulin. Rationale: corrects DKA by reversing acidosis and hyperglycemia. Strategy: in DKA, IV insulin always first, after establishing airway and fluids. Question 4. Case study scenario. A post-op abdominal surgery patient suddenly reports severe abdominal pain, rigid abdomen, and shoulder tip pain. Vital signs show tachycardia and hypotension. Question: what is the nurse's first action? A. Increase IV opioid dose. B. Place patient in high Fowlers. C. Notify the surgeon immediately. D. Encourage deep breathing. Answer C. Notify the surgeon immediately. Rationale: signs of possible internal hemorrhage or perforation. Requires emergency intervention. Strategy: sudden severe post-op deterioration equals call surgeon immediately. Question 5. Case study scenario. A patient with left-sided heart failure reports worsening dyspnea. Lung sounds reveal crackles. O2 sat is 88%. Patient is anxious and using accessory muscles. Question: which action should the nurse take first? A. Administer IV furosemide. B. Place patient in high Fowlers. C. Obtain chest x-ray. D. Check daily weight. Answer B. Place patient in high Fowlers. Rationale: positioning improves oxygenation immediately. Strategy: airway before interventions. Question 6. Case study scenario. A patient with a history of COPD suddenly becomes restless, confused, and has an SpO2 of 86% on 2-liter nasal cannula. Question: first action. A. Increase oxygen to 4 liters. B. Call respiratory therapy. C. Encourage coughing and deep breathing. D. Switch to a Venturi mask. Answer: D. Switch to a Venturi mask. Rationale: Venturi mask delivers precise oxygen for COPD patients. Strategy: COPD to controlled O2 delivery. Question 7. Case study scenario. A patient with acute pancreatitis reports severe epigastric pain radiating to the back, unrelieved by narcotics. HR 120, BP 94/60. Question: what should the nurse do first? A. Increase IV fluids. B. Give additional pain medication. C. Insert NG tube. D. Call for a CT scan. Answer: A. Increase IV fluids. Rationale: hypovolemia is common in pancreatitis and can lead to shock. Strategy: stabilize circulation first. Question 8. Case study scenario. An elderly patient with a hip fracture has difficulty breathing, chest pain, and petechiae on the chest after surgery. Question: priority action. A. Call the provider. B. Administer oxygen. C. Administer anticoagulants. D. Obtain an ECG. Answer: B. Administer oxygen. Rationale: classic fat embolism, oxygenation is immediate priority. Strategy: airway first. Question 9. Case study scenario. A postpartum patient becomes pale, dizzy, and her fundus is boggy with increased bleeding. Question: first action. A. Start oxytocin infusion. B. Massage the uterus. C. Call for blood transfusion. D. Check hemoglobin. Answer: B. Massage the uterus. Rationale: uterine atony is most common cause of postpartum hemorrhage. Strategy: fix the cause before calling provider. Question 10. Case study scenario. A patient with a chest tube following pneumothorax suddenly reports severe dyspnea. Drainage container shows no tidal movement. Question: what should the nurse do first? A. Increase suction. B. Assess chest tube connections. C. Administer pain medication. D. Notify the provider. Answer: B. Assess chest tube connections. Rationale: lack of titling, possible disconnection or obstruction. Strategy: always check equipment first. Question 11. Case study scenario. A patient with cirrhosis has abdominal distension, dyspnea, and shifting dullness on percussion. Question: what is the priority action? A. Restrict fluids. B. Measure abdominal girth. C. Prepare for paracentesis. D. Obtain daily weights. Answer: C. Prepare for paracentesis. Rationale: ascites causing respiratory compromise requires decompression. Strategy: treat breathing threat first. Question 12. Case study scenario. A patient on heparin for DVT has hematuria, black stools, and bleeding gums. PTT is critically elevated. Question: first action? A. Reduce the heparin dose. B. Stop heparin infusion. C. Administer protamine sulfate. D. Notify the provider. Answer: B. Stop heparin infusion. Rationale: stop the source of bleeding immediately. Strategy: stop harmful agent first. Question 13. Case study scenario. A traumatic brain injury patient shows a sudden increase in blood pressure, widening pulse pressure, and irregular respirations. Question: what is the priority? A. Administer mannitol. B. Prepare for intubation. C. Call the neurosurgeon. D. Elevate head of bed 30 degrees. Answer: D. Elevate head of bed 30 degrees. Rationale: Cushing's triad equals increase ICP. The arrow positioning reduces pressure quickly. Strategy: least invasive, most effective first. Question 14. Case study scenario. A burn patient becomes hoarse with stridor and difficulty swallowing. Question: first action? A. Start IV fluids. B. Give pain medication. C. Prepare for intubation. D. Apply oxygen mask. Answer: C. Prepare for intubation. Rationale: airway edema threatens airway patency. Strategy: inhalation injury, secure airway immediately. Question 15. Case study scenario. A patient receiving a blood transfusion develops chills, fever, and back pain 10 minutes into infusion. Question: priority action? A. Slow the infusion. B. Stop transfusion. C. Administer antihistamines. D. Obtain urine sample. Answer. B. Stop transfusion. Rationale. Possible acute hemolytic reaction. Strategy. Stop the blood, then assess. Question 16. Case study scenario. A patient with asthma suddenly becomes silent during an acute attack. Question. What should the nurse do first? A. Give albuterol. B. Prepare for intubation. C. Assess pulse oximetry. D. Call the rapid response team. Answer. B. Prepare for intubation. Rationale. Silent chest equals impending respiratory arrest. Strategy. Airway protection first. Question 17. Case study scenario. A patient with acute kidney injury has K equals 7.1 milliequivalents per liter in peaked T waves. Question. What is the nurse's first action? A. Administer insulin with glucose. B. Give sodium polystylamine sulfate. C. Restrict dietary potassium. D. Prepare for dialysis. Answer. A. Administer insulin with glucose. Rationale. Rapidly shifts potassium into cells. Strategy. Stabilize cardiac conduction immediately. Question 18. Case study scenario. A patient with heart failure is on digoxin. The patient reports nausea and blurred vision. Heart rate is 48 BPM. Question. Priority action. A. Administer digoxin. B. Hold digoxin and notify provider. C. Give antiemetic. D. Monitor for 1 hour. Answer. B. Hold digoxin and notify provider. Rationale. Symptoms indicate digoxin toxicity. Strategy. Hold medication causing danger. Question 19. Case study scenario. A child with meningitis presents with nuchal rigidity, fever, and a petechial rash. Question. Priority action. A. Administer IV antibiotics. B. Apply cooling blanket. C. Maintain NPO. D. Start seizure precautions. Answer. A. Administer IV antibiotics. Rationale. Bacterial meningitis requires immediate antibiotic therapy. Strategy. Treat the cause rapidly. Question 20. Case study scenario. A patient 2 hours post-thyroidectomy suddenly becomes stridorous and has difficulty speaking. Question. What is the nurse's first action? A. Call the surgeon. B. Prepare for emergency tracheotomy. C. Check calcium levels. D. Reassure the patient. Answer. B. Prepare for emergency tracheotomy. Rationale. Airway obstruction from swelling is life-threatening. Strategy. Airway emergencies override calling provider. Question 21. Case study scenario. A patient with suspected stroke arrives with slurred speech and right-sided weakness. The last known well time was 45 minutes ago. Blood glucose is 60 milligrams per deciliter. Question: what should the nurse do first? A. Prepare for CT scan. B. Administer aspirin. C. Give IV dextrose. D. Notify neurology team. Answer: C. Give IV dextrose. Rationale: hypoglycemia can mimic stroke, must be corrected first. Strategy: always rule out reversible causes before activating stroke protocol. Question 22. Case study scenario. A patient on TPN begins to sweat, tremble, and complain of dizziness. The TPN bag is almost empty and no replacement is available yet. Question: what is the nurse's priority? A. Stop the TPN. B. Hang 10% dextrose. C. Call the pharmacy. D. Check triglycerides. Answer: B. Hang 10% dextrose. Rationale: prevents sudden hypoglycemia when TPN runs out. Strategy: replace with dextrose anytime TPN is interrupted. Question 24. Case study scenario. A patient with a pulmonary embolism suddenly becomes tachycardic, hypotensive, and cyanotic. Question: first action. A. Increase IV fluids. B. Administer oxygen. C. Prepare for thrombolytics. D. Obtain CT scan. Answer: B. Administer oxygen. Rationale: immediate oxygenation is the priority in PE crisis. Strategy: airway, then breathing, then circulation.
Question 24. Case study scenario. A patient with chest trauma has paradoxical chest movement and severe respiratory distress. Question: what is the nurse's first action? A. Apply high-flow oxygen. B. Prepare for intubation. C. Administer morphine. D. Obtain ABGs. Answer: A. Apply high-flow oxygen. Rationale: flail chest compromises oxygenation. Oxygen improves gas exchange. Strategy: prioritize breathing support in trauma. Question 25. Case study scenario. A newly diagnosed patient with Addison's disease suddenly becomes weak, confused, and hypotensive. BP 80/40. Question: priority action. A. Administer IV hydrocortisone. B. Check electrolytes. C. Start a high sodium diet. D. Draw cortisol levels. Answer: A. Administer IV hydrocortisone. Rationale: Addisonian crisis is life-threatening. Steroids are the immediate treatment. Strategy: treat before diagnosing. Question 26. Case study scenario. A patient with active GI bleeding has HR 130, BP 86/50, and cool, clammy skin. Question: what is the first action? A. Insert NG tube. B. Administer IV fluids. C. Prepare for endoscopy. D. Check hemoglobin. Answer: B. Administer IV fluids. Rationale: signs of hypovolemic shock. Restore circulation rapidly. Strategy: ABCs. Circulation is priority with blood loss. Question 27. Case study scenario. A patient with pneumonia is now confused, has RR32 and SpO2 84% on 4-liter nasal cannula. Question: first action. A. Increase oxygen flow. B. Switch to non-rebreather mask. C. Call provider. D. Obtain sputum culture. Answer: B. Switch to non-rebreather mask. Rationale: NRB provides highest oxygen concentration without intubation. Strategy: escalate oxygen delivery before additional interventions. Question 28. Case study scenario. A diabetic patient on an insulin drip suddenly becomes sweaty and difficult to arouse. Bg equals 40 milligrams per deciliter. Question: what should the nurse do first? A. Stop the insulin infusion. B. Call provider. C. Give IV dextrose. D. Recheck glucose. Answer: C. Give IV dextrose. Rationale: treat life-threatening hypoglycemia immediately. Strategy: correct the dangerous symptom first, then reassess. Question 29. Case study scenario. A patient receiving vancomycin develops flushing, itching, and hypotension. Question: what is the priority? A. Stop the infusion. B. Slow the infusion. C. Give epinephrine. D. Apply oxygen. Answer: A. Stop the infusion. Rationale: Red man syndrome, stop infusion immediately. Strategy: stop harmful agent before treating symptoms. Question 30. Case study scenario. A patient with alcohol withdrawal is tremulous, hypertensive, and reports visual hallucinations. Question: what is the first action? A. Administer benzodiazepine. B. Provide fluids. C. Notify provider. D. Reduce stimulation. Answer: A. Administer benzodiazepine. Rationale: prevents progression to delirium tremens. Strategy: treat withdrawal aggressively and early. Question 31. Case study scenario. A patient receiving chemotherapy reports fever, chills, and sore throat. ANC is 300. Question: Priority action. A. Begin neutropenic precautions. B. Administer antibiotics. C. Provide oral care. D. Draw blood cultures. Answer. B. Administer antibiotics. Rationale. Neutropenic fever is a medical emergency requiring immediate antibiotics. Strategy. Treat infection risk before diagnostics. Question 32. Case study scenario. A trauma patient arrives with suspected spinal cord injury. The patient is cyanotic with shallow breathing and weak diaphragm movement. Question. First action. A. Apply cervical collar. B. Check pulse. C. Prepare for intubation. D. Start IV fluids. Answer. C. Prepare for intubation. Rationale. High cervical spinal injury equals respiratory failure risk. Strategy. Airway always first in trauma. Question 33. Case study scenario. A pregnant patient at 36 weeks has BP 176 by 110, severe headache, and clonus. Question. What should the nurse do first? A. Administer magnesium sulfate. B. Induce labor. C. Administer antihypertensives. D. Monitor reflexes. Answer. A. Administer magnesium sulfate. Rationale. Prevents seizures in severe preeclampsia. Strategy. Prevent seizure before lowering BP. Question 34. Case study scenario. A patient with asthma reports worsening wheezing despite using an inhaler. Peak flow is 38% of personal best. Question. Priority action. A. Administer nebulized bronchodilator. B. Increase oral fluids. C. Encourage pursed lip breathing. Or D. Provide corticosteroid tablets. Answer. A. Administer nebulized bronchodilator. Rationale. Severe asthma requires immediate bronchodilation. Strategy. Use the fastest acting airway treatment first. Question 35. Case study scenario. A patient with cirrhosis has confusion, tremors, and a musty breath odor. Question. First action. A. Restrict protein. B. Administer lactulose. C. Obtain ammonia levels. Or D. Insert NG tube. Answer. B. Administer lactulose. Rationale. Treats hepatic encephalopathy by reducing ammonia. Strategy. Treat the cause, not labs first. Question 36. Case study scenario. A patient with chest pain becomes unresponsive. The monitor shows ventricular fibrillation. Question. What should the nurse do first? A. Begin chest compressions. B. Defibrillate immediately. C. Administer epinephrine. Or D. Call code team. Answer. B. Defibrillate immediately. Rationale. VFib requires immediate defibrillation to restore rhythm. Strategy. Shock first in shockable rhythms. Question 37. Case study scenario. A patient with rheumatoid arthritis on long-term steroids reports black tarry stools. Question. Priority action. A. Check hemoglobin. B. Notify provider. C. Begin proton pump inhibitor. Or D. Hold steroid dose.
Answer: B. Notify provider. Rationale: possible GI bleed, urgent evaluation. Strategy: notify provider before interventions requiring orders. Question 38. Case study scenario. A patient with suspected appendicitis has sudden relief of pain followed by rigid abdomen. Question: what is the nurse's priority? A. Prepare for surgery. B. Give analgesics. C. Start IV antibiotics. D. Keep patient NPO. Answer: A. Prepare for surgery. Rationale: sudden relief equals rupture, leading to immediate surgical emergency. Strategy: rupture means immediate surgical emergency. Question 39. Case study scenario. A patient with a central line develops fever, chills, and purulent drainage at insertion site. Question: first action. A. Remove the line. B. Obtain blood cultures. C. Apply warm compress. D. Give antipyretics. Answer: B. Obtain blood cultures. Rationale: must culture blood before removing the line or giving antibiotics. Strategy: always culture first in suspected line infection. Question 40. Case study scenario. A patient with suspected bowel obstruction is vomiting bile, has absent bowel sounds, and severe abdominal distension. Question: what is the nurse's first action? A. Insert NG tube. B. Administer antiemetic. C. Give IV fluids. D. Prepare for CT scan. Answer: A. Insert NG tube. Rationale: NG decompression relieves pressure and prevents perforation. Strategy: relieve obstruction before fluids or diagnostics. Question 41. Case study scenario. A diabetic patient with foot ulcer has foul drainage, fever, and elevated WBC. Question: priority intervention. A. Administer antibiotics. B. Clean the wound. C. Check A1C. D. Apply warm compress. Answer: A. Administer antibiotics. Rationale: signs of infection, antibiotics first. Strategy: treat infection before wound care. Question 42. Case study scenario. A patient recovering from near drowning has now pink frothy sputum and severe shortness of breath. Question: first action. A. Administer diuretics. B. Prepare for intubation. C. Give steroids. D. Obtain ABGs. Answer: B. Prepare for intubation. Rationale: pulmonary edema from aspiration threatens airway. Strategy: airway protection comes first. Question 43. Case study scenario. A patient receiving nitroprusside for hypertensive crisis suddenly becomes confused and hypotensive. Question: what should the nurse do first? A. Stop the infusion. B. Increase IV fluids. C. Check thiocyanate levels. D. Call provider. Answer A. Stop the infusion. Rationale: sudden hypotension equals overdose, so stop medication. Strategy: stop dangerous med first. Question 44. Case study scenario. A child with epiglottitis is drooling, anxious, and sitting forward. Question: priority action. A. Obtain throat culture. B. Prepare for intubation. C. Start IV antibiotics. D. Provide cool mist. Answer: B. Prepare for intubation. Rationale: drooling equals airway obstruction danger. Strategy: never examine throat. Secure airway. Question 45. Case study scenario. A patient with hyperthyroidism has fever, heart rate 160, and altered mental status. Question: what is the nurse's first action? A. Administer beta blocker. B. Provide cooling measures. C. Increase IV fluids. D. Monitor ECG. Answer: A. Administer beta blocker. Rationale: thyroid storm to control HR to prevent cardiovascular collapse. Strategy: treat life-threatening symptoms first. Question 46. Case study scenario. A patient with peritonitis is febrile with rigid abdomen and rebound tenderness. Question: first action. A. Start IV antibiotics. B. Draw blood cultures. C. Administer opioids. D. Give antiemetics. Answer: A. Start IV antibiotics. Rationale: life-threatening infection requires immediate antibiotics. Strategy: treat first, then diagnostics. Question 47. Case study scenario. A patient on PCA morphine becomes very drowsy. RR drops to 8 per minute. O2 sat 85%. Question: priority intervention. A. Stop the PCA. B. Administer naloxone. C. Apply oxygen. D. Call rapid response. Answer: B. Administer naloxone. Rationale: reverses respiratory depression quickly. Strategy: fix the cause of hypoventilation first. Question 48. Case study scenario. A patient with DKA is now alert and eating. BG is 210 milligrams per deciliter. IV insulin is still running. Question: what should the nurse do first? A. Stop the insulin drip. B. Transition to subcutaneous insulin. C. Give IV dextrose. D. Increase fluids. Answer B. Transition to subcutaneous insulin. Rationale: DKA resolved. Need to bridge to subcutaneous insulin before stopping the drip. Strategy: prevent rebound hyperglycemia. Question 49. Case study scenario. A patient post-craniotomy has clear drainage from the nose that tests positive for glucose. Question: priority action. A. Notify neurosurgeon. B. Apply nasal packing. C. Lower head of bed. D. Administer antibiotics. Answer A. Notify neurosurgeon. Rationale: CSF leak, risk for meningitis and increased ICP. Strategy: immediate provider notification required. Question 50. Case study scenario. A patient with sickle cell crisis reports severe pain, dyspnea, and swelling in the hands. Question: what is the first action? A. Administer IV opioids. B. Start IV fluids. C. Apply warm compress. D. Obtain CBC. Answer B. Start IV fluids. Rationale: hydration decreases sickling, improves perfusion. Strategy: treat the cause first. Fluids before analgesia.
Great job completing all 50 case study questions. Every scenario you just worked through builds the clinical judgment you need not only to pass the Nclex, but to walk confidently into real-world nursing practice. If these case studies helped you, make sure to stay tuned for the next set. More critical questions, more rationales, and more targeted strategies are coming your way. Drop a comment with the topics you want next: pharmacology, maternity, pediatrics, mental health, or high-priority emergencies. Remember, consistency beats intensity. Keep practicing, keep growing, and success on the Nclex is only a matter of time. See you in the next session. Your journey to becoming an exceptional nurse continues.